On this Monday night, forced to pivot during the pandemic, doctors become ICU nurses.
We have to stand together to get through this awful wave.
One hospital's emergency measures to cope with a shortage of critical care staff. A 13-year-old girl becomes one of Canada's youngest COVID-19 victims.
Emily, I said, no, I can't be.
How she died and the agony for her family. In Alberta, the impact of outbreaks at multiple oil sands work sites and the complaints from travelers about a COVID testing company. Global News investigates. Plus, was anyone watching? The Oscars' dubious new distinction. Even the best actor was asleep when he won.
Global National with Donna Friesen.
Good evening and thanks for joining us. We are still engulfed in this third wave of the pandemic, but there are at least glimmers of hope in terms of case counts. Canada's 7-day average of new daily cases fell by 2.6% from the week before. That means restrictions and vaccines are slowing down the spread, but the number of people ending up in the hospital is still on the rise, up 22% in the last week. ICU cases are up 21%. Ontario is hardest hit. 877 patients are in intensive care, more than double the number from the start of April, and 24 more people died from COVID-19 in Ontario. Among the dead, a 13-year-old girl from Brampton. Emily Viegas died at home. Her father, Carlos, unable to save her.
Carlos was the only member of his family of 4 to test negative for COVID-19. His wife was at Brampton Civic on oxygen, struggling with the sickness, and when his daughter Emily's condition started to deteriorate, he didn't know what to do. He did his best to take care of her, and he thought that Emily would get better soon.
We will have Emily's story in a moment, but we begin with the shortage of critical care nurses in Ontario. The provincial government is now requesting help from the Canadian military, and doctors who don't usually work in intensive care are being redeployed as nurses as ICUs fill up with younger patients, including pregnant women. Jeff Semple has our top story tonight.
I need more pumps.
Even for pandemic-hardened hospital staff, the newest arrival to this intensive care unit is tough to stomach.
Young people who get into this tragic situation, that's even more heartbreaking.
A woman in her mid-30s and pregnant. She tested positive for COVID-19 and had to be intubated. Doctors delivered her baby via C-section while she was unconscious. The baby survived, but the mother is now in a coma.
And we noticed that she's just not improving, and in fact, she's actually getting worse.
A lot to handle, especially for someone who has never done this job before. Dr. Cinziana Avranescu is an anesthetist who typically works in the hospital's operating room. But starting this week, she's being redeployed as a critical care nurse.
I feel that this is our chance to help.
This hospital, like many others, is grappling with a shortage of ICU nurses. As a result, every day, precious ICU beds sit empty.
And I said, if you need my help, if there's anything I can do to coordinate and help in this situation, let me know.
And this is the result.
Or that they're continuous infusions.
Within days, Avranescu and her colleagues organized a crash course to train dozens of doctors to become critical care nurses.
We have to stand together. It's a camaraderie thing. It basically is supporting each other and just kind of standing shoulder to shoulder to get through this awful wave.
Most here are surgeons and anesthetists who volunteered after Ontario cancelled non-emergency surgeries. They're used to working in the ICU and caring for the critically ill, but the differences between jobs are daunting.
We're going to be doing things that we're not necessarily super comfortable doing.
ICU nurses are typically tasked with caring for a single patient. They undertake years of schooling and months of specialized training to work in the ICU, now being condensed into a couple of days.
Doctors normally don't manage IV pumps or how to turn a patient safely or how to document as a nurse rather than document as a doctor. They're very different techniques.
They admit the move isn't without risk, but by training up to 40 new nurses, the hospital can double its ICU capacity to ensure every patient who needs a nurse receives one. Jeff Semple, Global News, Toronto.
A field hospital has been set up in Toronto and it's begun taking patients now. One person was admitted to the mobile health unit outside Sunnybrook Hospital this afternoon. More patients are expected to start filling the beds this week. It will take in people who are recovering from COVID-19 to free up space for those who are seriously ill and need treatment inside the hospital. Well, 13-year-old Emily Viegas never made it to the hospital for treatment. She is one of the youngest people in Canada to die from COVID-19. She deteriorated quickly, and her father, who works in a warehouse, found her in bed without vital signs. Eric Sorensen has her story.
One of the few consolations in the pandemic has been the fact that few young people have died, but it can happen. 13-year-old Emily Viegas of Brampton passed away last week. Seen here on her mother's social media page, Emily had been sick at home and was being cared for by her father.
To our knowledge, this is the first person under the age of 19 that has died of COVID-19 within our health system.
In a region with very high numbers of COVID cases, Emily's father, according to the Globe and Mail, was worried his daughter might be taken to a hospital further away than nearby Brampton Civic, where her mother was already being treated for COVID-19.
This is a very difficult thing to decide to do, to seek care. But what I can say is, from a reassurance standpoint, if you come to our hospital, you'll get the best care we can deliver.
Recently, the rate of cases in Ontario has been much higher for younger age groups, particularly 20 to 29. But the rate of hospitalizations is still higher among older Ontarians, and the death rate remains highest for those over 80. The rate of deaths under age 20 is exceedingly rare.
Even with the variants, children and adolescents are much more likely to have no detectable disease or mild disease than severe disease requiring hospitalization.
But families must be vigilant. Lisa Brown's 2-year-old son apparently got COVID at his daycare, and before long, the entire family of 4 was sick. The toddler took it hard for several days.
He developed a cough and a runny nose, so it took him about 7 or 8 days to get through the whole process of getting better.
Lisa's family recovered, but it's stressful.
I now invite the honourable members to rise.
For 13-year-old Emily Viegas, a moment of silence today in the House of Commons. In Brampton, the death of one so young is devastating.
Our community is heavily filled with essential workers. And in this case, it's a warehouse worker who their family was doing everything right. They weren't socializing. They were staying home.
Health professionals say marginalized communities where essential workers are being hit hard, there is a need for greater healthcare access, paid sick days, and for vaccines. Emily's death is a tragic loss for the family and for a community that has been hit so hard by COVID-19. Eric Sorensen, Global News, Toronto.
COVID cases keep rising in Nova Scotia, and today more restrictions were imposed there. A record 66 new infections were reported today, the highest single-day count since the start of the pandemic. Starting tomorrow, Halifax area schools will be shut down to in-person learning for 2 weeks, and regions outside Halifax face new restrictions, including stricter limits on indoor and outdoor gatherings and a ban on social and sports events.
We need everyone to slow down, stay close to home, and take this seriously, from Yarmouth to Amherst to Sydney.
Manitoba is tightening restrictions again as COVID infections begin to rise again. Starting on Wednesday, no one will be able to have visitors at their home, indoor or outdoor, for 4 weeks, apart from some exceptions for people who live alone. Outdoor gatherings in public places will be capped at 10 people. Manitoba's test positivity rate hit 7.6% today, the highest since late January. When you break it down per capita, Alberta still has the most active COVID-19 infections in Canada. According to Canada's Public Health Agency, there are 455 cases per 100,000 people in Alberta. Ontario is second, followed by Manitoba and BC. Within Alberta, the hardest hit region per capita is the municipality of Wood Buffalo, home to Fort McMurray and Canada's oil sands. The region has declared a state of local emergency. It's asking for more vaccines and fast to help protect people from the virus. Heather Yurix West reports on where it's spreading and who is getting sick.
I've been sick since last Sunday. That's when I came down with my symptoms.
This man, who we've agreed not to identify, is now isolating at a hotel outside Edmonton with COVID-19. He got sick last week while working at the Canadian Natural Resources Horizon Oil Sands site near Fort McMurray.
A lot of my coworkers are getting sick. It just doesn't seem like anyone's caring about what's happening up there. Too many people are getting sick, and they're basically playing with people's lives because COVID has been known to take people's lives.
CNRL would not comment on how many of its workers are sick, but Alberta Health says outbreaks have been declared at 9 oil sands work sites in the region. On Sunday, the regional municipality of Wood Buffalo declared a local state of emergency.
We want to know what support this region can receive from other levels of government. And one of the most obvious, I think, is further vaccine support if supply can be provided.
Canada's oil sands are considered an essential service, producing 3 million barrels a day. A shutdown could lead to fuel shortages across the continent.
Most of the refineries in that whole region are dependent on production from the oil sands. So it would have a big implication if the oil sands had to ramp back production. And, if it went way down, it would be devastating.
Of course, COVID-19 doesn't care, and in Alberta, the more highly transmissible variants are fueling exponential growth.
They can be up to 2.5 times more infectious than the strain we were dealing with last year. But we also have to remember that although our provincial numbers are now almost as high as they were at the peak in December, we still have fewer restrictions in place.
Meaning the virus will continue to spread among essential workers at the sites of Alberta's oil sands and the community just beyond. Heather Urex West, Global News, Calgary.
The B.1.1.7 variant, first detected in the UK, has now been found in Canada's far north. Nunavut's chief public health officer says testing has confirmed the variant is circulating in the capital, Iqaluit. The territory has 47 active cases now. Most are in Iqaluit. Officials are urging people who have not been vaccinated to get their shots. Canada is making slow and steady progress in getting people vaccinated. 29% of the population has received at least one dose now. Almost 3% has received both doses. The government is expecting a big boost in deliveries this week, nearly 2 million more doses. As Abigail Beeman explains, the ramp-up can't happen soon enough.
This line to nab a jab for only about 100 available at this Ottawa walk-in clinic.
My husband's on about 15 or 17 waiting lists, so it's very, very difficult to be able to find something.
I'm on about 17 waiting lists. I've called all the pharmacies in the city, and the only reason why I'm sitting here is because my son hooked me up with vaccine hunters.
Many Ontarians frustrated they have to rely on a volunteer-run Twitter account to get the shot. They may be the lucky ones. Some Ontario pharmacies have been cancelling appointments. They will all run out of AstraZeneca within the week, hoping today's reports the U.S. will share its 60 million doses with the world could help.
We're hopeful with the federal government's discussions in the U.S. of bringing up AstraZeneca that will happen. But right now we have no certainty, so it's likely there will be an interruption of supply.
Pharmacists are in talks with the province to launch a pilot program to administer Pfizer as soon as this week. It's offered the steadiest supply, with another 1 million shots coming this week and 2 million a week for all of May. And for the first time, the one-shot Johnson & Johnson vaccine will arrive at the end of this week. 300,000 will roll out to the provinces next week.
The vaccine hesitancy is actually a very broad and complex issue.
J&J has a similar PR battle as AstraZeneca, with rare blood clots causing a pause in the U.S., lifted as of Friday.
These vaccines are highly effective, nearly 100% effective at preventing those really severe outcomes. And the safety concerns that have come up are around risks that are very, very rare.
The National Advisory Committee on Immunization has not yet issued guidance on the use of Johnson & Johnson, saying Friday it was waiting to see what happened in the U.S. And so far, no provinces have taken up NACI's recommendations on AstraZeneca, allowing it to be given to people in their 30s. Abigail Beeman, Global News, Ottawa.
Begging for life-saving oxygen. Coming up, India's desperate pleas for help. Oxygen is in such short supply in India. Families who can afford to are paying black market prices to get canisters so their loved ones can breathe. About 1.7 million people have tested positive in the last 5 days. That is 500,000 more than Canada's total case count. More than 352,000 new cases were reported in the last day, a world record, and 2,800 deaths were confirmed. Although, as Redmond Shannon reports, it's believed India's actual death toll is much higher.
roadside oxygen on the streets of Delhi, set up by volunteers at a Sikh temple. Among the patients who were turned away from overflowing hospitals is 32-year-old Abu Sadat. His brother tries to keep him lucid. We don't know if he survived. His father and volunteers decry the government's handling of the brutal, deadly surge in COVID-19 cases.
I don't know what the government is doing. But then we can do it. Why can't government not doing?
Prime Minister Narendra Modi has ordered Twitter to remove posts that criticise the government's handling of the pandemic. Critics say Modi didn't take the threat of a second wave seriously and is now too slow to react. So serious is the situation, officials are even advising people to wear masks in their own houses amid growing concerns about the B1617 variant.
Definitely there is more deaths than the recorded ones. This is for sure.
Dr. Harjit Singh Bhatti says patients are on average younger and sicker than during India's first wave. Even the vaccinated are getting infected, although they may not be as ill.
University professors, army officers, when such influential people are not able to get the beds, then you can just think about the poor people, how much suffering they are facing right now.
The UK, the EU and the WHO are sending aid, including machines to produce oxygen.
We absolutely need to help other countries around the world, and right now India is going through a horrible situation.
The Canadian government says it has been in touch with India about sending PPE and ventilators, but as Canada struggles with the pandemic at home, no details of aid have been confirmed as yet. Redmond Shannon, Global News, London.
Ahead, the Toronto startup facing complaints about its COVID testing at Canada's borders. Hundreds of thousands of international travelers are still making their way into Canada each month, and making sure they are properly tested for COVID-19 is critical. Switch Health is a Toronto area startup doing that testing, but many travelers say the company is struggling to keep up with demand. As Roberta Bell reports, there are fears it could leave Canada open to more deadly variants.
Yeah, there's a little video of you. It says nurse will be with you shortly.
Tyler Harvey in Calgary says that wasn't the case for him. He went online to do a supervised COVID test on March 9th after returning from a work trip to the U.S.
It showed of 1,418 people. I realized that I might not actually be getting the test done on day 10.
He says he waited for 5 hours only to be cut off when the platform closed. The next day, he says he got disconnected again.
I called Public Health Canada a couple times and asked, I said, hey, I know I'm not supposed to leave quarantine until I get this day 10 test. So what am I supposed to do here?
Toronto-based startup Switch Health won a federal contract in February and now manages coronavirus tests for hundreds of thousands of travelers arriving in Canada.
The nurse will take you through the following steps.
Travelers swab themselves in their homes or hotel rooms while an RN watches via video chat. Then couriers deliver the samples to labs. But Global News found hundreds of negative online reviews. From allegations of incomplete test kits to login issues, long lines, and problems with pickup. We spoke to about a dozen people who complained about the system.
It's clear that Switch is a giant mess.
Greg Skinner was back in BC after visiting his 10-year-old daughter who lives in the States. He says he spoke to a customer service agent on the phone on March 10th to complain and said he couldn't get through to a nurse.
And also in that process, then he told me to do it yourself too.
While the Public Health Agency of Canada says it's not aware of cases like this one, it is aware a small number of travelers were unable to book their telehealth appointments within the testing timeframe and is working with other federal partners and the company on solutions. Switch Health says it can't respond to individual user allegations, but that it has advised its call representatives all tests must be nurse monitored. And as a still new company, it says it needs time to adjust to the exponential demand it's adding and training more staff. Switch Health told Global News that 250 online complaints represented only 0.007% of all the tests administered to date. But with new, more contagious and more deadly variants continuing to arrive, public health experts say the situation could get worse. Roberta Bell, Global News, Regina.
Next, an historic win and a big upset at the Oscars. Movies have given us much-needed distraction, even if we have to watch them on small screens. But our love for awards shows has dimmed considerably. According to the Nielsen ratings, Hollywood's biggest night, the Academy Awards, was watched by fewer than 10 million people last night, a record low and a 58% drop from last year.
And the Oscar goes to Nomadland.
Nomadland won 3 of the biggest prizes, including Best Picture. And Chloe Zhao, who was born in China, made history, becoming the first Asian woman to win Best Director.
This is for anyone who has the faith and the courage to hold on to the goodness in themselves.
The Chinese government imposed a virtual news blackout and censored social media posts about her win. The final award was Best Actor. The late Chadwick Boseman was nominated for Ma Rainey's Black Bottom, and it was thought he might win.
And the Academy Award for Actor goes to Anthony Hopkins, The Father.
But it was Anthony Hopkins who got the Oscar for his role in The Father. Except he was at home in Wales, asleep. He sent in an acceptance speech this morning.
Very grateful to the Academy and thank you. And I want to pay tribute to Chadwick Boseman, who's taken from us far too early.
It is Hopkins' second Oscar, and at age 83, he is the oldest actor to receive one.
Isn't it?
And that is Global National for this Monday. I'm Donna Friesen. Tonight's Your Canada is the town of Ituna, Saskatchewan, northeast of Regina. Please email Your Canada to viewers@globalnational.com. Thanks for watching. Hope to see you here again tomorrow. Take care of yourselves. Bye-bye.